Hello everyone. So our today's topic is breast disorders. In that we gonna learn about the mastitis disorders. So what is mastitis? So mastitis is an acute inflammation of the interlobular connective tissues within the mammary glands. So in the breast there are the mammary glands present. In that there are lobules present in which they are made up of connective tissues. So in that lobes there will be inflammations in an acute form. So that is known as mastitis. Now anatomy of the breast. So basically the breast is located vertically in an extent from the second to sixth ribs. So from the second till the sixth rib vertically, the position of the breast is been there. Now, predisposing factors of the mastitis. So damage in the nipples, cracked nipples or nip fissures present in the nipples are been the predisposing factors that affects the condition of the mastitis. Now next is primiparity. In primiparity means a woman who is bearing a child for the first time and giving a birth to a offspring at a one time. So primiparity is the condition in which the woman is bearing or conceiving a child for the first time, very first time, and giving a birth to an offspring for the first time is called a primiparity. Next, previous history of the mastitis. In case if the person is having a mastitis and she'll have risk of getting or easily prone mastitis for the second time. Next, maternal or a neonatal illness. In that, maternal illness is a condition in which it acts as a predisposing factor in the mastitis condition as well as the neonatal illness. Then maternal stress. Due to maternal stress, there will be inflammation or there will be fluctuations or ups and down in the hormones that are responsible for the mastitis. Then work outside the home. So usually the working women gets most of stress, and due to that the work outside the home is a predisposing factors in the mastitis condition. Then trauma, some physical trauma at the breast or in the breast. So this is the other factor, and the last one is the genetics. Now classification. In classification, first is infectious, second is non-infectious, third is milk stasis, and last is abscess formation. So in infectious one, it will be a bacterial infection. In non-infectious one, there won't be an infections related to bacteria. We'll study it in later in detail. So infectious, most common pathogen is Staphylococcus aureus. So the basic most common pathogen of the mastitis condition is this Staphylococcus aureus bacteria, and sometimes also this Streptococcus is also been detected. Next, non-infectious causes. It includes the carcinomatous process in which the cancerous cells that have been present in a cancer conditions, it will be hyperplasia of the cell. That is, the number of the cell is been increased in the condition of the cancerous cell, and that leads to the obstruction in the ducts that are present in the breast. Now, breast abscess. A breast abscess is a collection of the pus that develops into the ducts of the breast. So, there will be collection of the pus that will be developed or collected in the ducts of the breast. Now, milk stasis. So, milk stasis means building up of the milk within the breast tissues or the ducts of a lactating woman. So, here the woman who is lactating might be have a chance of building up the milk within the tissues of the breast or the ducts present in the breast. Now, the stagnant milk increases pressure in the breast, leading to the leakage in the surrounding breast tissue. So, the stagnant milk, so the collected milk in the breast may increases the pressure on the breast, and that leads to a leakage of the milk from the breast tissue as well as from the breast also. Now milk itself causes an inflammatory response. So the milk is a product in which the composition consists of the lactose, and that increases the inflammatory responses in the this condition. So milk even gives an favorable environment to the bacteria to grow in a multiplication times or multiply very easily. Now classification. In classification, there are two types, that is purpural mastitis and non-purpural mastitis. In purpural mastitis is an inflammation of the breast that is connected with the pregnancy or the breast feeding. So it is related to the pregnancy or during the pregnancy and the breastfeeding time. So that is known as purpural mastitis, and in that case it is caused by the blocked ducts. In that, if the mother is having an engorged breast, that is engorgement or the breast milk is being collected and stored or been tendered over there, so that is the cause where the milk ducts gets blocked. Next, non-purpular mastitis. The term non-purpular mastitis describes inflammatory lesions of the breast occurring unrelated to the pregnancy and the breastfeeding. So, non-purpular mastitis is a condition where it is not related to the pregnancy and the breastfeeding. It is been other than the pregnancy and the breastfeeding, that is the trauma or some kind of genetics conditions or cancerous cells growth, etc. Next, clinical features. Breast tenderness is being found or warm to touch, means warm means feeling like it's having a temperature on the upper skin of the breast, and the breast will feel tendered on the physical examination. Then general malaise or feeling ill. General malaise means feeling weakness. So these are the things which are the symptoms that are being observed during the conditions of the mastitis. Even swelling of the breast is being seen in the physical examination. Pain or burning sensation is being continuous or while breastfeeding. So the burning sensation as well as the pain is being felt by the mother if the mother is breastfeeding, or even to the mother who are not a lactating women. Clinical features: skin redness, often in the wedge shaped pattern. So, the skin redness will be in a shape or a pattern that is in a wedge shaped. Further, I have kept an image to let you know how the redness is being looked like. Next is fever that is being increased, that is 105, 101 or more than that. The affected breast can be then start to appear lumpy and red. So now if the breast is affected with an mastitis, then the breast will appear so lumpy like that there is a lump inside the breast, and the breast will appear red in color. Now stages: cellulitic stage and then abscess, in which the breast in cellulitic stage, in which the breast as a whole becomes red and extremely painful. So in this stage, the breast will become red, whole breast will become red, and that will be very painful. Next, in abscess stage, when the abscess develops, redness becomes limited to area of an abscess formation. So here, after this cellulitic stage, there is an abscess stage in which the abscess is being formed, where the collections of the fluid or the accumulation of the fluid or the pus is been there. Next stages, in that edema means swelling, tenderness means getting tendered or hardening. Brownie indurations are the three main features of the abscess formation. So these are the three main features of an abscess formation. In that, brownie induration means getting hardening of the skin due to the inflammation. So due to inflammation, the skin will be get hardened. So that is browning induration. So basically, edema, tenderness, and brownie induration are the three main features of the abscess formation. Now, test and diagnosis. The diagnosis of the mastitis and breast abscess can usually made by the physical examination in the routine physical examination, then ultrasound in which the breast tissues have been helpful to distinguish or differentiated between the simple mastitis as well as the abscess. So we'll be able to distinguish or differentiate the mastitis, simple mastitis, and if the woman is having an abscess in the ultrasound. Next, the diagnosis of the mastitis. In case of the infectious mastitis, cultures may be needed in order to determine what type of an organism is causing the infection. So here we'll need to take the cultures to determine which organism is causing this type of infection. In that, Staphylococcus aureus A and B group, hemolytic, hemolytic, then Streptococcus E. coli and H. flu. Next, MRSA. MRSA means methicillin resistant Staphylococcus aureus. This is a test been done to detect if the patient is having and resistant to a methicillin or many other antibiotics or not. Next is fungal infections. Next, test and diagnosis. Mammograms or mammography or a breast biopsies are being normally performed on the woman who doesn't respond to the treatment that we are giving on the basic conditions for the simple mastitis. So if the woman is not responding to the treatments, that is the antibiotic treatments we are giving for the simple mastitis, then we should go or we should tell her to go for a mammography or a breast biopsy. So this is what mammography, in which the tumors or the non-cancerous or the cancerous cells have been detected. So this is a process similar to the sonography, but this is particularly for the breast. Now complications. In that, breast abscess is a complication. Here in the figure you can see the abscess that is been formed in the subcutaneous layer as well as subareolar part. That is a basic, that is complicated but not that much as the deep abscess. You can see in the figure where the deep axis is been seen. So that is a severe condition or a very complicated stage where the deep abscess can also affect the surrounding organs of the breast. Next, other complication, distortion of the breast and chronic inflammation. So distortion of the breast means something that is being altered from the natural thing. So the natural functions of the breast have been altered a bit high. And next is chronic inflammation. The inflammation that doesn't heal and just goes on for a longer time is called chronic inflammation. Now treatment, supportive therapy in that rest, fluids, pain medications, anti-inflammatory agents that are NSAIDs, and for the lactating mastitis, frequent and emptying of the both breast by breastfeeding is essential. Okay, so we have to empty both of the breast from of the milk through the breastfeeding, or else what we can do is we can use the breast pump and remove all the extra amount of the milks that are present in the breast. So we have to empty frequently the both breast. Next, also essential in adequate fluid supply for the mother and the infant. So we need to adequately give fluids to the mother as well as the infant too. Now treatment, infectious mastitis, in that dicloxacillin and cephalexin are the medications that are being used in case of penicillin resistant staphylococci. Means the patient who have an penicillin resistant staphylococci means they don't respond or they don't have resistance to the penicillin tablets. So in case of that, we used these two of the medications, and the minimum treatment is being given about 10 to 14 days. Now, and abscess that is been suspected or an abscess in the breast may be treated by the ultrasound guided fine needle aspiration, that is percutaneous aspiration is being done, or by the surgical incision and the drainage. So here by the help of the ultrasound or by the guidance of the ultrasound in the side, we have to do a aspiration through the fine needle and through the percutaneous layer. We have to aspirate all the abscess or the pus formation, pus accumulation that is being there in the abscess. We have to remove all through the needle, or else what we can do is an surgical incision. We can make an surgical incision and connect a drainage tube, and we can let it drain through that tube. So these are the treatment or the procedures that we can do for the breast abscess. Now, in case of perpetual breast abscess, breastfeeding from the affected breast should be continued where possible. So, if it is possible that the mother is having a breast abscess, still she can give breastfeeding. If that is possible, we have to allow her. So this was the topic mastitis. Hope you all are able to understand, and we'll continue our other topics of the breast disorder in the next video. Thank you.